has to be in place, this kind of foundational sort of scientific validity. If there's a new treatment or a new approach, it has to be tested. It has to go through the rigor of the scientific process. So scientific validity is an important sort of fundamental piece. Then in the case of psychology with practitioners in the field who are helping patients, it needs to be legal, whether you can use a certain drug, use a certain approach, and it needs to be reimbursable. So for a psychologist to be able to treat a patient, and it is not classified as a treatment that can be reimbursed for through healthcare or any of the programs, that's a huge roadblock. That's an obstacle. It's a practical obstacle. But the fourth one maybe that comes to mind here is probably the most interesting one. This is a cultural aspect. Are people ready? Even if the science is there, if there's no legal barriers, if there's financial compensation for the practitioner to invest their time into it, are patients ready? And I think the psychedelics area is an interesting one where there's probably experimentation happening by patients who are at the end of the line. They don't have any other options, and they start experimenting with that. So was it the nugget or the noodle that you just shared about the shift in the thinking around this? That's a good indicator that people are considering the validity of some of these psychedelic research, because we published last year in 2020 in the Journal of the Psychology of Consciousness a comprehensive review of the validity of psychedelics in treatment settings, and there's some good data on psilocybin in particular for PTSD and certain other settings. I'm not, again, a psychologist and don't know the specifics, but I think culturally we do see a shift happening already, but there's still some barriers.